So there's a bleak warning out, ladies and gentlemen, of what's yet to come in the upcoming months as we're getting into fall, getting into closer to the winter season. Obviously, this is the big annual time of the year for cough and cold season, flu season. That's pretty much annual. Everybody knows about that. That's kind of expected. But they're giving out a bleak warning because now they're saying there's a triple threat. There's a triple threat coming at you that's going to affect a lot of people. And what exactly is this triple threat? Because it sounds scary. Well, what they're saying is that there's going to be, on top of cold and flu season, on top of COVID, now they're saying that there's increased cases of RSV and it's overwhelming hospitals. So here's this that was reported. This is CTV News saying that U.S. hospitals overwhelmed with young RSV patients. Is Canada seeing the same trend? So what exactly is this RSV? Well, it's not a new COVID variant. Don't worry. It's not another variant because I know there's like 20 million of them out right now. They're already mentioning about an XXB version on top of the B8, B5. I don't even know. They're literally giving it like names that I heard of Star Wars characters named after them. I don't know. But RSV, according to the Mayo Clinic, is a respiratory syncytial virus. And it says causes infections of lungs and respiratory tract. It's so common that most children have been infected with the virus by age 2. Respiratory syncytial virus can also infect adults. So they're saying on top of COVID, on top of regular cold and flu season, that this is going to be the incoming trend and it's going to overwhelm hospitals and we don't know what's yet to come. And they're saying that this is a triple threat, that this is going to be the worst season imaginable. But here's where this gets interesting. So the article goes on by saying as U.S. pediatric hospitals report being overwhelmed with respiratory syncytial virus patients, cases are also on the rise in Canada. Respiratory virus, or RSV, is a common contagious respiratory virus that often affects young children. According to the U.S. Centers for Disease Control, virtually all children get an RSV infection by the time they are aged 2 years old. The virus mostly causes mild cold-like symptoms like runny nose, sneezing, coughing, and fever, but it can lead to more serious illness such as pneumonia and bronchitis, which is inflammation of small airways in the lungs. Children under 6 months and those with pre-existing conditions like asthma and congenital heart failure are among those at risk for severe complications, which can require hospitalization. So, they're saying that there's going to be these cases coming up on top of COVID, on top of the regular cold and flu season. That's what they mean by the triple threat. In the U.S., several hospitals currently report being overwhelmed by a surge of young RSV patients. This is our March of 2020. Dr. Frank Belmont from the Advocate Children's Hospital in Chicago told ABC News, this is the pediatric version of the beginning of the pandemic. So this is where I scratch my head a bit. And this is where I kind of get conflicted. Because, yeah, RSV, yeah, that's a contagious illness. And, yeah, a lot of kids get it. But as the CDC points out, it's so common that almost every single child gets it by the time of age 2. So apparently it's almost like chickenpox in a way. Yes, you can get severe illness from this and you can get hospitalization, but if it's so common for young kids, so very young common, and it seems common that children go through it like a common cold, should they really be calling this a pandemic? Is this really a fear moment? Is this part of the triple threat that's going to scare everybody? Are we going to go back to the situation that we were in that didn't really make sense to anybody and actually made society even worse? Is it really worth it? At the Connecticut Children's Medical Center, they've even considered bringing in the state's National Guard to help expand the hospital's capacity. I have been at Connecticut's Children's for 25 years, and I've never seen this level of surge, especially of RSV. Their physician-in-chief, Dr. Juan Salazar, told CNN. And again, well, at least the National Guard, at least they're getting the National Guard to actually protect the nation. I'll have to say that. I give credit to that, because the last time we mentioned about the National Guard, they were heading off to Africa to start an illegal war. So it's nice to see the National Guard helping the nation, which kind of goes hand in hand. National Guard, nation. So now here's what they're saying about here in Canada, because they're saying it's going to expand and we're going to see a rise in cases. So it says the Public Health Agency of Canada, meanwhile, is reporting a rise of cases in much of the country, and particularly in Quebec, at a time when many Canadian emergency rooms are already struggling with long wait times and capacity issues. And notice how this never gets addressed on regular mainstream media. Notice how they don't mention about back before the pandemic, Doug Ford, the Premier of Ontario, actually scrutinized on hospitals, cut back on hospital budgets, and fired a bunch of nurses and doctors before the pandemic happened. That's one of the reasons we're in this mess, and the reason why they're overwhelmed is because they're understaffed, they're underfunded, and they're underpaid in this situation. And they purposely manufactured this crisis. They purposely manufactured the fact that there's not enough beds, the fact that there's not enough ICU rooms to treat these people. It's purposely done. And none of this was mentioned beforehand. None of this was mentioned. But they're saying it's because of too many sick people that they're getting overwhelmed. Not the fact that there's corruption and they've stripping away on healthcare here in Canada. Respiratory virus activity is above expected levels for this time of year. The agency's most recent weekly RSV outcome from October 15 stated, like the flu, RSV infections typically come in a seasonal wave that lasts from fall through spring. So in other words, it's pretty much as common as any seasonal cold, allergy, or flu. But they still want to make you panic and call this a triple threat and the possibility of another pandemic situation. Because they still have to fearmonger you for something. They still have to get you in panic in order to get more vaccines, in order for Big Pharma to sell you and manipulate you so you get glued to the news, so you get the false information, not get the accurate information. So you start segregating more people, again, from vaccinated to unvaccinated, from believers to non-believers. Like, it's just crazy. Like, we're restarting this all over again because of something that is so common with young kids that's basically a seasonal thing. It's so common that's basically treated the same way as the flu. In fact, kids die more of the flu than probably than RSV. That's what the outcome is saying. This, though, is the bullet point here that I want to make. They say the current increase in RSV cases is widely being linked to measures to stop the COVID-19 pandemic. That right there is the big thing to note. Because I have heard doctors, I have seen studies, I have seen articles outside of the, Pfizer-controlled mainstream media, outside of CNN, outside of, if you actually go to real medical sciences and medical journals that have published documentations of this, they have been telling us the important thing about this virus is to build up your immunity. And they've been saying that for every single flu season. They've been saying that with every single contagious virus, that the important thing with any respiratory illness, with any flu, any cold, anything like that, the important thing is to build up your immunity. What does that mean? It means, talk about vitamins. How we're not mentioning about vitamins, how we're not mentioning about losing weight, how about we're not mentioning about dieting, how we're not mentioning about going outside, getting some fresh air, vitamin D. We're not mentioning anything about that. We're not mentioning about immune boosters that are actually more beneficial than the vaccine that artificially builds up your immunity. But then that doesn't last. And that's why people that are getting vaccinated are also catching COVID. And this is well documented. Well proven. Scientific studies have proven time and time again. Here's even this. We've shown you this before. Israel studies offer strongest proof yet of vitamin D's power to fight COVID. Not one single mainstream doctor, not Fauci, not Sanjay Gupta, none of them will mention something like this. And that could be the cause of what's happening here. Because we're telling, people to isolate themselves, create this little bubble, and they're not going to build their immunity if they're locked in their rooms. They're not gonna get better. They're not gonna build their immunity, their bodily functions, their ability to fight off future illnesses if they're sitting at home. They need that vitamin D. They need that fresh air. They need that to get out and build up an immunity so they can fight off illnesses and ailments that come to them. So that is the biggest thing to note about this. That the lockdowns and the isolation, the separation, the exiling of people from society until they, get compliant with the big agenda of the pharmaceutical industry and the government, how they have to be compliant with science, which is not how science works, was actually worse, had a worse outcome. Because now those people don't have a strong enough immunity to fight off this triple threat. That's why this is a big deal. In Canada, lockdowns, masks, and social distancing contributed to RSV numbers plummeting to 239 confirmed cases in 2020 and 2021, according to the Public Health Agency of Canada, down from 18,860 confirmed cases in 2019 to 2020. Experts say a lack of exposure for approximately 2 years has left more young children vulnerable at the same time. Young kids need that vitamin D. Young kids need to go outside. Young kids need to be exposed. And I know people are going to say that's chaotic. Well, what about the people that are going to spread this contagious disease around them? You know what happens? Your body attacks that and builds up immunity as you're getting better. That's why they say the best immunity from COVID was actually getting COVID. The people that caught COVID were able to build up an immunity naturally and are able to be more immune to future cases than the people that were vaccinated. That's the scientific reports reporting on that. That's what data is showing. But Rachel Maddow will tell you that, vaccines just completely stop it. Completely stop the virus. And I have to tell you that they're great. But like I said, take it as you will. Take all this information as you will. It's your decision. You decide. You do your own research, which in my day was called studying. And you figure out exactly how dangerous this triple threat is. Because, yes, RSV is a serious thing. But is it really that serious when it's so common that it's treated like a flu? And considering we're coming up to flu, cold, and cough season, that we have to talk about reinstating another pandemic situation, having the National Guard in, when really we should be talking about building up our infrastructure for healthcare? How about having more funding during a pandemic situation? How about funding more of healthcare? If you're so concerned about doctors and nurses being overwhelmed, why are you not demanding the provincial governments? Why are you not demanding the federal governments? Why are you not demanding governments in the United States to increase the funding for healthcare? If you're so concerned about the overwhelming of hospitals, of all these sick people, why are we not getting more ICU beds? Why are we not getting more help for these doctors and nurses? Why are you not paying them better wages? Why are you not helping, getting back some of the nurses and doctors you fired beforehand? Why is the United States not implementing Medicare for all so that people can get treatment? So that we do decrease the cases. Now you understand how manufactured this all really is. And you have to take it with a grain of salt to understand exactly what's happening. Because this just seems like taking this to the step of fear-mongering when it shouldn't. It really, really shouldn't. And no disrespect to the people that, catch this. Nobody wants to be sick. Nobody wants to be ill. I understand that. But scientific claims, and you look through the data, you look through the analysis, you question what they are saying, you question the what doctors have been treating people, and things just don't add up. Things don't add up from what Fauci is saying to what Dr. Malone is saying. Things don't add up from, what CNN reporter Sanjay Gupta is saying versus, nurses that have actually treated people with COVID. And who are you going to trust more? CNN doctor or a nurse who's actually dealt with people with these illnesses? My money is going with the latter. So, anyway.